First, a lawsuit over illegal solitary confinement for teens in Illinois may have led to changes. Our Investigates team breaks down the new details from the Mary Davis home in Galesburg. That leads your news at 10 after TV6 Investigates uncovered new details in a solitary confinement case in Galesburg. Good evening, I'm William Ingalls.
And I'm Kate Kopatich. The Mary Davis home faces a lawsuit which accuses them of confining teenagers for 23 hours a day for weeks at a time.
But now policies at the Juvenile Detention Center could be changing. This all stems from a lawsuit TV6 Investigates brought you first last year. It claims the Mary Davis home repeatedly broke state law. Testimony from teens detained at the center claimed special group status, or SGS, put them in solitary for long stretches. And beyond that, were refused mental health services while in solitary confinement, even when they were on suicide watch. This led to an injunction last month which forced the facility to stop their confinement practices while the court process continues. And to release a plan, to address care for teens who threaten self-harm or suicide.
And overnight, Mary Davis home leaders released their plan to address and care for kids in a mental health crisis. First, the facility announced plans for 3 separate trainings. Some will be for all staff, while some will be just for leadership. The plan also walks through policies that watch over teens from the moment they enter the facility. They detail what places a teen on suicide watch, what happens when they're on suicide watch, and when teens are taken from the facility if they have mental health conditions that can't properly be treated on site.
And I have been looking into this case for more than a year, and that was key as the Mary Davis home attached several of their policies to the court filing. Some of them had small tweaks in recent months, but only one of them saw major revisions since 2022, and it was all that sparked the key issue in this lawsuit: solitary confinement. That policy was put into effect last month and clearly lays out teens can only be confined 15 minutes at a time, and every 15-minute extension must be documented. Notably, the policy never mentioned special group status, which was at the heart of the original lawsuit. Instead, the Reset program is listed as the most severe behavioral designation. While teens on Reset have several restrictions and requirements, the policy states that they are to be kept with the rest of the teens at the facility whenever possible and only separated when absolutely necessary. While the policy sets the guidelines, the first part of Reset says, quote, "There is no one-size-fits-all approach with residents who continually refuse to comply with behavioral expectations, become a safety risk to themselves and or others. Therefore, those placed in the Reset program are determined on a case-by-case basis." I reached out to Mary Davis Home Superintendent Wendy Steck this afternoon to clarify if Reset is a replacement for SGS. I have not heard back at this hour. I also